Assalamualaikum and salam sejahtera. My name is Syafawati Binti Abdul Manap, a 4th-year student majoring in medical physics at School of Physics in University Science Malaysia. In this video, I'm going to talk about diagnostic of anteriovenous malfunction in cerebral by using angiography. To begin, an arteriovenous malfunction, or known as AVM, is an abnormal tangle of blood vessels connecting arteries and veins which disrupt the normal blood flow and oxygen circulation. As we know, arteries are responsible for taking oxygen-rich blood from the heart to the brain, and veins responsible for taking oxygen-depleted blood back to the heart and to the lung. Hence, when an AVM disrupts this critical process, the surrounding tissues may not get enough of oxygen, and because of the tangled blood vessels that form the AVM are abnormal, they can weaken and rupture. If the AVM is in the brain and rupture, it can cause bleeding in the brain, stroke, and brain damage. However, fear not, as once it is diagnosed, a brain AVM can often be treated successfully to prevent or reduce the risk of complication. Now, let's take a look at how angiography plays a part in this story. An AVM can be diagnosed by using angiography. Angiography is an imaging test that uses X-ray to view the blood vessels. The X-ray provided by an angiography are called angiogram. This test is used to study narrow, blocked, and large malformed arteries or veins in many parts of the body, including brain, heart, abdomen, and legs. In this video, we are going to focus on the diagnosis of brain AVM by using cerebral angiography. Let's get into it. Cerebral angiography helps to diagnose medical conditions that involve arteries and veins in the head, neck, including the brain. During cerebral angiography, highly specialized doctors are able to observe the blood vessel by using modern sophisticated imaging equipment. In order to take pictures of the blood vessel, a contrast medium or dye is injected into the targeted blood vessel through a small, soft, and flexible tube called a catheter. Images of the blood vessel are obtained by injecting the contrast medium through the catheter into the blood vessel, and by taking X-ray pictures as the contrast medium travels through the arteries and veins. So, having said that, how is cerebral angiography actually done? Now, I'm going to walk you through the procedure of cerebral angiography. First, the procedure is performed in a room specifically designed for angiography of the nervous system, which is the neuroangiography suite. Once in the angiography suite, the nurse will give you a combination of medication that will help you relax and remove any uncomfortable sensation during the procedure. In addition to the sedation medication, the doctor will also apply a numbing medicine to your groin in order to ease any local discomfort. Then, the catheter will be then inserted into an artery in the leg, which is femoral artery, through a small skin incision. Accessing the femoral artery gives the doctor a direct pathway to the vessel of the head and neck without crossing or coming close to the heart. When the catheter is in the correct position, the contrast will be injected into the blood vessel. During this time, X-ray pictures of the blood vessel are taken. It is important to remain still while the contrast travels through the blood vessel so that the pictures that are taken are in a good quality. Therefore, you will be asked to hold your breath for a short period of time, which is around 10 seconds during each contrast injection. At the end of the procedure, the catheter is removed from the groin, and the doctor will hold pressure at that site for 15 and 20 minutes, and a bandage is applied. And that's it. An angiogram gives a very detailed picture of the blood vessel. Angiograms are used to make specific diagnosis and to help determine what is the best treatment in a particular case. Often, the treatment itself can be performed using the same type of the catheter used in the angiogram. It's important to note that complications can happen during angiography, which include allergic reaction to the contrast agent, kidney impairment, damage or blockage to a blood vessel, potentially causing a stroke, and bleeding at the site where the catheter was placed. In conclusion, angiography gives a lot of benefits that help to diagnose patients and can save many lives. Through angiography, we will be able to prevent and reduce the risk of complications of a particular case if we are able to diagnose it earlier. Okay, that's all from me. Thank you for watching.